Yo matata
Let's all stand up and have fun. Matata hayo, hayo. Akilut, hayo matata. Thank you. You are so beautiful. Ladies and gentlemen, allow me to welcome all the dignitaries as per protocol. Today we are commemorating one of the special days. Gauteng. We have lost so many people due to HIV and AIDS, those who were hopeless. But now our government has made sure treatment is there, of which is accessible and free. In that regard, the people like Abu Simon Koli, they failed to get the treatment on time. We are celebrating them. Bonkosi Johnson, they've paved the way. And I want you to know that for you to be here is not a mistake. For you to be here, people will know the meaning of World AIDS Day. Ladies and gentlemen, allow me to welcome on stage MMC Eunice Mtina. My apologies. Let me allow the choir for the national anthem. Thank you. Let's all stand with due respect. Thank you. Let's give them a round of applause. Thank you, thank you, thank you, thank you, thank you, thank you. As I've indicated earlier, we'd love to call MMC Eunice Mgcina, who is the Community Development Planning in the City of Johannesburg. Let's give her a round of applause when she comes to the podium.
Thank you very much, Program Director. Let me acknowledge the Program Directors, MEC Mutara and Ms. Mtaung, the Honorable Premier in absentia, as well as the MEC for Health and Wellness in absentia, the Gauteng Provincial Director General, Mr. Musue, the leadership of faith-based organizations present here today, MMCs from other municipalities that are here today, and councillors who are present in this event, Mr. Anthony Ambrose, the Global Fund primary recipient, Honorable Emma Moore, who's the member of the Gauteng Legislature, the chairperson of the Civil Society Forum, Ms. Gladys Chabalala, the chairperson of Private Sector Forum, Mr. Gaugelo Mushala, my colleagues, or my colleague here, where we are, the ward councillor of the area, Isibonda Sendao, Ukansela Umnyameni Mongameli, all officials present here today, ladies and gentlemen, good morning. Once more, program directors, Honorable Premier in absentia and MECs. I saw MEC Shilwane as well. I think he was here earlier on. I hope he is still around. He is acknowledged as well. Fellow councillors across our province, distinguished guests, ladies and gentlemen, I rise today with the honor of delivering this welcome address on behalf of the Executive Mayor of Johannesburg, Councillor Sillo Dada Morero. The Executive Mayor has asked me to extend his warmest greetings to each of you and to convey his sincere regret that he cannot be with us this morning due to other pressing council business. He has asked me, program directors, to assure you that his spirit is very much present in this gathering and that he remains deeply committed to the cause we commemorate today. And on behalf of the Executive Mayor and the people of Johannesburg, I welcome you all to this important provincial commemoration of World AIDS Day 2025. Today we gather not only to remember the millions of lives touched by HIV and AIDS, but also to reaffirm our collective commitment to the ending this epidemic in our lifetime. As the city of Johannesburg, we have made a significant stride in the fight against HIV and AIDS through expanding testing, access to treatment, and community-based programs. We have seen infection rates decline and more of our residents living healthy and productive lives. Our partnerships with civil society, healthcare workers, and communities have proven that when we work together, progress is indeed possible. Yet, colleagues and friends, we must be clear. We cannot be complacent. The fight is not over. Too many of our people, especially young women, vulnerable communities, and those living in poverty remain at risk, stigma and discrimination still continues. And while science has proven us that tools to prevent and treat HIV, it is our responsibility to ensure that no one is left behind. As leaders in Gauteng, we must continue to strengthen our collaboration across municipalities, share best practices, and invest in prevention, education, as well as treatment. Ending HIV and AIDS is not the responsibility of one city or one government department. It is a shared mission that requires unity, compassion, and sustained action. Let us use today not only to commemorate, but to recommit ourselves to a Gauteng where every citizen has access to treatment, where stigma is eradicated, and where future generations will know HIV and AIDS only from historical accounts. On behalf of the Executive Mayor, I thank you and I welcome you once again to Johannesburg. Together, let us continue to journey towards an AIDS-free Gauteng. With those words, ngizothanda ukuthi ngibonge nama-program directors ethu nabo bonke abantu abakwazile go fihla mo tlhakanong ya rena. Ke itumetse. Thank you very much.
Thank you, MMC, for those words of welcome. And I'm sure all of us now are welcome here in the city of Johannesburg. We now have an item of entertainment. I'm not sure who's going to render it, but if the culture group is not ready, we can ask the choir to come up while we proceed to the next item. I think they are on their way up. Thank you.
While we're still waiting for cultural groups, Aubrey, Mr. Mchali, and Nina, you'll come and join us on stage when we'll be doing candlelight. Ke utlwa kgetsa kere ka nako ya candlelight Ntate Mchali, Aubrey ga ke re gana bana le lona le rata tsela.
rona rotlhe batswala re pina ena ke rona rotlhe batswala bakwena ba ngwatso ba kgatla ba kalaka re ba dira ba lete ba yeye ba herero le ba sebetsa
Mic is off. Thank you. Thank you so much, cultural group. Without any waste of time, we'll be calling PLHIV leader in Gauteng, Munabi Zimbasa, Aubrey, Mr. Mchali, Nina, to come forward as we'll be doing candlelight. And more dignitaries in Sarnakopa, MEC Border, all the MMCs, Civil Society Forum Chairperson, Provincial Private Sector Forum Chairperson to come forward as we'll be doing candlelights. Siyaya, siyaya, siyaya. Gubi, gubi, yo. Siyaya, siyaya. Riabang rintifasi. We can't go to rintifasi. To the other side.
Tubula besi shaya o besi bo pasaya no au gubi 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 o siaya o siaya siaya no au pambili pambili Amanda, viva CSF, viva! Viva CSF, viva! Amanda! Comrade, without any waste of time, Comrade Malema is going to lead us in candlelight service.
Greeting everyone. I believe that immediately when we hear Malema, it's like, okay, are we? Hallelujah. Firstly, I want to greet all the distinguished guests who are in our midst and our chairperson who's with us here. Before I can say a lot of things, can you hold the candle in your hand so that we can start. Before we can continue, I want us to read the scripture from the book of John, chapter 1, verse 5. It reads as follows. You are the light shine in darkness, and darkness did not comprehend it. Meaning, when the age encroaches our country, it was very dark because most of you will lack knowledge. That's why we had a lot of people who passed on because there was no knowledge. Because where there is no knowledge, people perish. But now we are standing here fortunate because now we have more knowledge, and we are saying, may this knowledge be spread. May we continue to make sure that we do awareness, because it is important for those who are not aware of what this HIV means. But now we are standing here to commemorate those who have passed on because of HIV, and then also to bring hope to those who are now having the same virus into their body, to say now we are now in a better place where we know that it is no longer darkness. There is a lot of hope because of the knowledge that we have. And then we are saying, as we will be lighting the candle, we are saying, let us spread more information to those who are still having a challenge of understanding this HIV. It is no longer a giant as it is. Now it is something that we know we can live with it, and then we can continue to defeat it. And we believe that through the researchers, we will be able to find better cure that can also eliminate this so that we must not have any challenge anymore. Thank you very much. Let's all stand as we are going to be lighting this candle. I will ask Bishop Omchali to also come closer.
Can we request the chairperson of the CSF, the chairperson of the private sector, and the PLHIV sector leader in the province to go down so that they will light the big candles, and also the MMC that have opened for us? I think the PLHIV sector, it's got a light, so you're going to lead us, Chair, and then we'll be followed by the chairperson of the CSF and the chairperson of the private sector and the MMCs. And we are going to assist each other. May I request also all the sector, the PLHIV sector leaders that are here to assist people in lighting the candles. So Bob Malema will lead us also on how we are going to do it.
Thank you very much. Thank you. We'll start with the people who are in front, as they will be lighting here. It is a symbol to commemorate those who have passed on, because we know that it was not an easy thing before we get this knowledge. We are going to light here just to say to them, they have fight a good fight of faith. And we believe that where we are now, we are in a better situation. Thank you. You can start.
While we are lighting, can we request the choir to lead us with a hymn?
Thank you very much. Let's have a moment of silence as we commemorate those who have passed on. Thank you very much. You can bend those lights using your fingers so that you can also feel the pain of those who have lost their loved ones. Thank you. Thank you. And we'll leave the rest of this candle in front so that we are saying, let the light continue. Thank you very much.
City valo valo dololo, valo valo dololo, valo dololo. Asina luvalo, asina luvalo, asina luvalo, ngalento siyenzayo. Ah! Asina luvalo, asina luvalo, asina luvalo. Yay! City valo valo dololo, oh valo valo dololo, city valo dololo, hey! Asina luvalo, asina luvalo, asina luvalo, ngalento siyenzayo. Asina luvalo, asina luvalo, asina luvalo, ngalento siyenzayo. Asina luvalo. Luvalo ngalento siyenzayo.
Thank you, thank you, thank you, thank you so much. Thank you very much. Our next session, colleagues, participants, guests, our next session is going to be a panel discussion on the multi-sexual HIV, TB, and STI response. Our facilitator is none other than Ms. Penny Libiani, a radio and TV personality. She's no stranger to us in Gauteng. Penny, please come up and your guests for your panel. Thank you.
Dumelang Thobela, Absheni, Dimasere, Abodi A, Kalina ke Penny, Oralibiane, Hadia Masorana, Slolo Savakoni, Barokal Mapulana. Judging Lalihono, I've been asked to facilitate the next session, and I will be calling on my panelists to come through and join me for this conversation. But before we do that, as a young woman at the age of 21, I got to be part of the national campaign with Love Life, Imagine an AIDS-Free Generation. And I have been in this journey with our country when in regards to health, into advocating and sending the right information to the nation for us to achieve this goal of ending AIDS. And of course, I've also worked on programs on mother-to-child transmission as well. So good morning, MECs, members of the mayoral committee who are here, MMCs, community leaders, health warriors, people living with and thriving beyond HIV, survivors and activists, honored guests, friends and people of Gauteng. We gather today on the soil in the heartbeat of the nation, not merely to commemorate, but to confront. We are here for World AIDS Day 2025 for the province, and our theme given to us is a charge, renewed efforts and sustainable commitment to end AIDS. Let us sit with that for a moment. Renewed efforts, that implies our previous efforts need renewal. It is an admission, it is a truth we must speak. Have we perhaps become fatigued? Has the global spotlight shifted? Has HIV for some become a chronic manageable footnote, making us not forget the agency, the pain, the stigma that still bends in our townships and our suburbs? Renewed efforts is a call to look at our complacency in the eye. It is a demand for innovation, not just in science, but in our outreach. It is a shout to the young person who thinks AIDS is over, and a whisper to the gogo still nursing a silent fear. We must renew our energy, our anger, and our compassion. And then sustainable commitment. This is the deeper challenge. We are experts of launches, at campaigns, at day-long commemorations with powerful slogans. But what about tomorrow and the next day, when the banners are folded and the cameras leave? A sustainable commitment is about budgets that are protected, not cut. It is about supply chains that do not fail, ensuring that pills are always and always available. It is about integrating care to seamlessly that a person coming for diabetes or hypertension is routinely offered an HIV test. It is about fighting for gender equality and economic justice, because these are the engines of the pandemic. To end AIDS, not to manage, not to reduce, but to end. Please help me welcome my panelists this morning to take us through what the province is doing. I'd like to call on Dr. Nkensani Nkwashu. Dr. Nkensani Nkwashu from SANEC. She's representing the CEO, Dr. Kulu, who couldn't be here, and she's a senior executive as well for NSP. She's one of those people who've championed this cause for over the years. Please give her a round of applause. Please also help me welcome Professor Kate Rees from Anova Health Institute. You may take a seat over there. Please also help me from PLHIV Munwabisi Mabasa, a provincial PLIV leader. May I request help that maybe the two chairs this side be moved there so that all my panelists are sitting in one spot. From the city of Johannesburg, please help me welcome MMC Tsegofatso Mashabela to come join me. From the city of Tshwane. Thank you. Please give a round of applause. Yes. Thank you so much. Please help me, if it's possible, the person who will be replacing the MEC here in the province in absentia, so that we can be able to drive this conversation. The replacement for Ms. Nobantu Nkomora Lehoko, who's the MEC for Health and Wellness in the province of Gauteng. If we may have someone coming through. Thank you so much. That's what my worry is. Okay. All right. Good morning, my panelists, and thank you so much for joining us this morning. I was going to take a seat with you there and run it like a panel, but this is Gauteng. We stand on business, so I'm going to stand on business of the work that we're trying to achieve as a province. I think you had in my opening impassioned remarks, you're a multi-sectoral a panel, and you all hold different roles within our communities and the sector in us achieving what we're trying to achieve. So this conversation, we're reflecting on the 2025 National World AIDS Day theme, renewed efforts and sustainable commitment to end AIDS in the national theme for our World AIDS Day for 2025. So what I'm trying to get at is to measure where we are, what are the key challenges, what are the opportunities, and how can we get there? But more than anything else, what have we done as a province? Because at the end of the day, we are a heartbeat of the nation one way or the other. And if we win in getting the message across and achieving the goals that are required, we can get there collectively as a nation. So I am going to start with you, MEC, from the city of Tshwane, because you're from the capital. I mean, MMC from the city of Tshwane, you're in the capital, and I'll move directly this way. What would you say, what are the key achievements from your area in the province that made HIV, TB, and STI response in 2025, particularly when it comes to the national theme? How does this message disseminate to people of Soshanguve, Mabopane, Mamelodi, Garankuwa, and etc. in your area?
Good morning, Penny Libani. I will stick to the protocol that has already been established. I'd like to greet the civil society because the question that you have asked, I think in the city of Tshwane, we are working very well with the civil society. And I think the civil society here in Gauteng as a whole, there are young people that have a plan to ensure that we can eradicate HIV by 2030. In the city of Tshwane, we have launched the AIDS Council only this year, after 8 years of it being forgotten, and we are trying to reach many parts that have been forgotten. We are in Soshanguve, we are in Hammanskraal, and we are in all the forgotten areas in the city of Tshwane through the help of the civil society. The work still needs to be done. There's a lot that still needs to be done in terms of making sure that we pass the 95-95 as it has been demonstrated. And we need, not only within the city, but we need a government that is going to show up. Must show up for the civil society, because outside us being political leaders, the civil society in the city of Tshwane and in Gauteng as a whole, they've shown that they have the political will to assist the politician in ensuring that we reach the broader communities. We are doing most of the work in the city of Tshwane. We are trying to reach all the parts. We have currently launched it in all our CHC clinic to ensure that the gap is not felt. So we are trying to make sure that it is broader known that HIV is no longer a stigma. It's something that we, if we can be united, we can challenge. Thank you so much.
Okay, thank you so much. I don't know why I'm being punished with the microphone. We're going to talk about that, the closing the gap and the 95-95, but I'd like to bring in the PLHIV, Munwabisi. I'm trying to start on the ground. You're the provincial leader, and to speak to that, echoing what the MMC has said, these renewed efforts and this sustainable commitment, these messages, what does it say and how does it speak to your lives daily as people living with HIV in fighting this pandemic?
No, thank you very much, Penny, and also greetings to all the leaders and the activists and everybody that is here. You know, civil society now is much stronger on the ground. Now we have formal structures that have been launched in all municipalities now. There is no gap in terms of that coherence and also better coordination on the ground, and also pulling masses, the communities to be at the center of the matter. What civil society has been doing. We've seen civil society being part of the most vibrant and pivotal campaigns that have been actually launched. Better Men for Tomorrow, Zikala Ganjan led by youth, Global Alliance to End AIDS in Children by 2030. What is now you are beginning to see this multi-sectoral approach being much more stronger and galvanized and working together now. I'm talking about government, civil society, and the private sector. Yes, there's still a lot that needs to be done, but we're on the correct trajectory, we're on the correct pathway to lead this particular ambition to end HIV, TB, and STI by 2030. That is what I can actually,
Most definitely, it's an ambitious project, and we want to grow together as Gauteng, that we achieve all those goals by 2030. The key achievements for the province made in regarding HIV, TB, and STI response in 2025. So I want to bring Sanek into the conversation. Dr. Nkensani, please just help us navigate this part on that ambitious task of saying, we want, we have this vision of 2030. But as SANEC, in your work with government, civil society, private sector, together with your developmental partners, the resilient provincial response by Gauteng, we have challenges of a decreasing budget, emerging challenges, and COVID-19 has also came into the factor. If we want to achieve this, what are we doing now, and what are the key learnings from the past to propel us to where we want to go in the future? Okay, the sound guys are behind you, so I'm hoping that this technical, so if we can just share mics for now, thank you.
Okay, thank you very much, Penny, and good morning to all my fellow colleagues who are sitting down, and I'll also stand on the protocol that has already been established. Ask me a that question. If you look at what SANAC does, SANAC is a multi-sectoral body. It's a coordinating body that coordinates the HIV response, TB and STI response in the country. And one of the key things that we always, that being a multi-sectoral body, we've got government, we've got civil society, and we've got the private sector that forms SANAC. So the key thing that we do, we ensure that we set up policies and we set up strategies that are going to be used by the provinces and anyone who comes into South Africa saying that I want to support the HIV and the TB response. So going down on the strides that we have led in the previous years and currently where we are, in relation to all the strategies that has been said, we have realized that there are different strategies that have been set in line with the National Strategic Plan. And one of the key ones that all of us today as South Africa, we can pat ourselves on the back, is to ensure that each and every person who is HIV positive, they access treatment. So on that, we did very well, and especially Gauteng being one of the provinces that has, the highest number of people who are HIV positive. And also additionally, even today, as we are sitting here, Gauteng is still one of the provinces where we are still seeing a high number of new HIV infections, especially amongst the youth. When you look at your 15 up to 25, and also from 25 up to 34, we see the peak still going up there. So yes, we have put people on treatment. We did very well. However, there are issues that speaks to overall HIV prevention. And we have learned also in other countries that even the saying that prevention is better than what? Is better than cure. So looking into that, it says that we need to do a lot when it comes to HIV prevention, especially when it comes to condom usage, which we have seen going down over the years. So this is something that we might need to pick up and also, highlight it, also ensuring that still the new cases that we are finding, they go into treatment. Those who have dropped off, they return back in treatment because the
Great stuff. Thank you so much, Dr. Kansana Nkwashu from SANEC. Dr. Kate Rees from Anova Health Institute, I'd like to bring you in. One of the key elements that the province has been working on, it is some of these campaigns like 1 on 1 million close the HIV treatment gap. MMC spoke earlier on about 95 to 95. So if we're testing 95%, we want that 95% to get on treatment. And then if we get them on treatment, we want them to stay on treatment. But these numbers, keep messing with us, literally almost like the antibodies in our body. But research and data is what informs us. In your space, innovation is central to renewing these efforts that we're talking about. And you were part of the 12th South African AIDS Conference. It highlighted, major innovation. Can you please just take us through that in prevention of new infections, and how can that particularly help the province prepare itself, and in terms of also introduction and rolling out the long-acting prevention injectables? So I know you're a scientist, but we wanted to get home. We want this conversation to land, in the different regions of our province.
Thank you so much. So I think innovation can sometimes be complicated and kind of fancy and scientific development, and we are lucky enough to have lenacapavir in that bracket. I'm sure most of us have heard of this 6-monthly injectable prevention that we are even seeing coming up to 12 monthly. So one of these days we will be getting an injection once a year that will help to prevent HIV. And you can imagine what that can mean for a young person or for a pregnant person. That can really transform how we prevent HIV. So the speed at which lenacapavir has come to South Africa has been really, I hate to say the word, but unprecedented. We've never seen anything like this before, and that is a real move towards sustainability, toward local ownership, and that is what we really need to focus on, thinking about how can we manufacture these things in South Africa. On the other hand, you have innovations that are much less high-tech, and I'm thinking, for example, of 6-MMD. You give someone 6 months of medication and they take it home and use it themselves. That is still an innovation, and it's something that is also transformative for the HIV response. It allows people to manage their own disease. It allows people to minimize how many times they need to come to the clinic, how much work they need to miss, and we've seen that it's safe and effective. And Gauteng will be starting that in April. So these are the two innovations that, to me, really highlight all of the things that are incredibly important at the forefront of the HIV response right now. We've got our incredibly important prevention and new medications development, but also the innovations and the changes in the way that we help our people with HIV to take their treatment, for the treatment to actually be accessible, and to empower people to manage their own illness.
All right, great stuff. Thank you so much, Doc, for that. Let me bring you in, Mr. Munwabisi, again, taking it to the people living with HIV. As a leader, all these campaigns, there's a conversation of what the province, the key campaigns, for example, the 326K, project, the 1.1 million close the HIV treatment gap, all about bringing people to care. And I think Prof just alluded to that, the different innovations that are available. And then whether we're talking U equals U, undetectable, untransmittable. And obviously, if we want to achieve the goal that we want to achieve when we talk about the Global Alliance to End,
children infections by 2030. On the ground, are these messages landing for people living with HIV and AIDS when you go to your local clinic, whether you're excited about the new innovation, whether it's about you taking the 6-month program? Are we getting there? Are we making progress? Thank you, MEC, for joining us.
Yes, we are seeing some strides there. The message is getting along. People are responding positively as well on how these campaigns.
Clarity, the MEC was meant to be part of our panel, but because our premier is part of the ANC GNC who couldn't be here, so the MEC will be addressing that part of our program, just you get understanding of that. So let me come back to you, Dr. Nkwashu, and talk about the work of SANEC. There's been panic. As much as we, for example, we have this global alliance to end AIDS in children by 2030. The reality is everyone wants to know the effect and impact of, PEPFAR work, stop order, global budget funds cuts, and things like that. So how do we speak to that, support the policy, support the MMCs, MEC and MMCs of health, throughout the province to achieve this vision and this ambition that we have as a province? And you have a national view as SANEC of how we're responding as a country.
Thank you very much, Penny. I think, coming into that question, first I'll start by highlighting that we are currently implementing the National Strategic Plan for HIV, TB, and STI. That started in 2023 and is supposed to take us to 2028. And with the development goals, by 2030, we are expected as a country and globally to have eliminated HIV, TB, and STI as public health threat. The reason I keep on mentioning the 3 diseases is because they coexist together. Yes, so in their coexisting, we've got a high number of HIV positive people who die from TB, and vice versa. The same goes the other way around. And we also, HIV start first as an STI. So when we were developing that plan, the plan was costed. And we saw that for us to be able to implement those strategies and reach the desired goals that we have set as a country, we need 270 billion in 5 years. And I think I'll re-emphasize this again, 270 billion in 5 years, which means it was from 2023 to 2028. And the total plan had a shortfall of 40 billion. And which means that the remaining 230 billion was the commitment from the South African government, from the private sector, from PEPFAR, and also from Global Fund. And as a country, we were able to raise plus or minus 70% of the 270 billion. So, and the bulk of that money, most of it, we are spending it on treatment. Currently, as a country, we've got plus or minus 8 million people who are on HIV treatment. So imagine that when we were already having a shortfall of that, 40 billion, and taking into consideration of the commitments that were already made by PEPFAR and also from Global Fund. PEPFAR being in the remaining 3, private sector, Global Fund, and PEPFAR. PEPFAR was a contributor amongst the 3. So when they withdraw their money, it some panic in the country and also amongst the implementers. And then Global Fund also followed suit. And we understand that their reduction is because also of the reduction that our PEPFAR or the US government did. I'm sorry, I'll mention that. So it indeed has a huge impact. Treasury tried, to close that gap and allocate some funding to the provinces, to be able to close. Although they've done that, it will not be enough. The other day, the Minister of Health was even saying that we really need to admit that that part that PEPFAR was playing, no one will come and give South Africa 20 billion currently.
Yeah.
When you look at with all these other things that are happening in other countries. Hence, as a country, we need to strengthen our prevention strategies because we're going to be caught off guard. If already I mentioned 270 billion and we are adding the numbers on an annual basis or on a monthly basis on top of that shortfall that I have mentioned,
Okay.
it already says something. That yes, we are panicking, but in our panic, we need to be smart and go to the drawing board, set smart objectives and smart strategies that will allow us to go to 2030 having eliminated this disease. Now at the global world, with all this shift that is happening, everybody is sitting down, re-strategizing. And I know that even at the global level, we are aware that none target. But we always say as South Africa, even if we have reached the TB target, it will mean something. We really need to work very hard. So I will say, let us not panic. Let us go to the drawing board. Let us strengthen our HIV prevention strategies. And I always say all the time when I speak, and we have indicated in the strategies, that prevention is key. We need definitely to look at prevention measures. And also noting that, yes, biomedical interventions, they work, we are putting people on treatment, but that is not only the method that is reliable.
Yeah.
Condom is still key. It's key, it's key. Condomize, condomize, condomize.
Awesome stuff.
see.
Thank you so much, Doctor. I'm going to bring in Dr. Percy Slepe, Chief Operating Officer for the Department of Health, representing the Gauteng Department of Health. I think let's just zone in on that, on the backdrop of what we've had from SANEC as a response as a nation and what the global, changes and movements are affecting us as a province. The reason we're gathered here is we want to reflect and we want to see how we can renew our efforts and sustain our commitments as a province. So when we speak to that, the key achievements that the province has made in fighting HIV, TB, and STI in 2025, particularly on the backdrop of all these issues from a national point of view and what's happening, the challenges, of the effect of PEPFAR, the Global Fund budget cuts. You're about innovation. Innovation and science equals money. And we have a challenge where, almost all the budget is going towards treatment, and we're struggling, in regards to prevention, a key message, lending, because then we're getting more infections. How do we innovate in the space that we're in from a scientific point of view? And how are you working closely with government to make sure that we are able to achieve that, for the messages that we're talking to today?
I mean, there's a lot to unpack there, and I think for all of us in the HIV response, but also in global health more broadly, it's been a really hard year. And just the fact of continuing to provide services and continuing to have ART and PrEP available across the country is an achievement, and it is something we should all be proud of, and that we're all still standing here today. I do think in terms of prevention, it's always the first thing to go. It's kind of the least visible in many ways, and so when the budget starts to get tight, prevention often falls away. But we are at a point where we cannot just be going on as before. As we've all said, the money is not coming back. We're not going to be able to act in the ways that we were before. So it's time to rationalize how we spend, prioritize, and then actually have the budget follow those priorities. And so if we are going to say prevention, 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 we need to follow the budget along with that. That's really the key thing. I think in terms of science and scientific development, it's an opportunity for us to throw off the kind of model of global health where North is in control and has a lot of the ownership, and to come forward as South Africa, as a leader in science, take up a lot of that space, take up some of the funding for ourselves, build partnerships with other global North institutions that we can actually lead and own, and in that way kind of continue to be a leader in science, but be a transformative leader in science. So we have these opportunities to do things differently. The integration was the other thing that's really important. Thinking about how to integrate at all levels of the health system to unlock efficiencies.
Okay, great stuff. Dr. Selepa, because you joined us briefly, I just want to get some point from you. When it comes to the conversation around Global Alliance to End AIDS in Children by 2030 in the province, how are we responding to that? Can you speak a little bit to that?
Yeah, our response it's very critical in that, but also not forgetting that we have partners that we work with in terms of responding to that. And part of that is also in terms of ensuring that we prevent the spread, especially the mother-to-child transmission. And I think as a department, we are doing very well in terms of that, as the statistics from our hospitals shows that we have reduced in terms of the mother-to-child transmissions.
Okay. All right, so in terms of messaging, MMC, I'm going to bring in you because when we talk mother-to-child, budget cuts, ultimately is what's happening on the ground in the communities, and you continue to implement that work, making sure that services at the local clinic, when people show up, they get what people came there for. How are we faring from your region?
I think with the budget cut, it actually taught us something as South Africa, that we must not rely.
Yes?
I think it has taught us that we must not rely on foreign nationals to fund critical aspects that deals with human lives. And the political will that South African government must show is that we must stop relying on US grants, especially to fund health aspects in our country. There's money in this country, Penny. There's money to fund all these campaigns so that we can reach the gap by 2030. But the money goes to wrong things in this country. We see what is happening in the country. We cannot say that such a huge department that is health gets to be underfunded, whether it's in a municipality, in legislature, or nationally. But you get people funding water tankers, finding infrastructures that just become a nightmare. We need to be a society whereby when we speak about health, you know that having a healthier nation is what you must strive for. And always underfunding health sector is going to make us rely on US grants, so that when there's political drama that is currently happening with the US government, we get these gaps in terms of how are we going to fund this campaign. But we have teams that responded aggressively to the cut. The work has not been stopped in communities, and we are actually not filling the gap that there's a grant that was cut. I think the way this country is responding, especially in communities, in our local communities, is that of showing that there had always been a will to fund this program, but because we had relied more on US governments to fund it, we are only seeing the potential now that these cuts are happening. happening, but the work still continues. That shows that this country can do it without any US grants. Thanks.
Okay. So our commitment is very important. From PLHIV, let me bring you in there as we get to a close. The importance of committing not to just what the province is doing and nationally, but on the ground, especially for people living with HIV in our communities and being part of getting the message to the communities. Can you please just share with us as we end, the commitment? Why is that so important?
It's quite important that we work together as stakeholders, government, private sector, and also, business, private sector, civil society, and also government. And in ensuring that, because we are all serving the same constituency, therefore, it will be unwise to work in silos. And in every decision that we make, it will always be important that we pull the communities along in the apex decision-making processes as well, unlike taking decisions elsewhere, wanting to impose them, to the communities. But what also should be noted from this meeting is that in order for us to change the material conditions on the ground, we need a strong political will from government, robust civil society, private sector involvement, efficient government services, and coordinated implementing partners. But mostly, communities must be at the center in terms of that. We've seen, we've learned a very painful way, as I phrase it, but now we need to tap into the local coffers in ensuring that we're able to bridge that gap. And we're happy that the Department of Health is also doing the same in terms of putting that commitment, forward as well. But we need also to ensure that our health system financing is something that is at the center of that particular, agenda. Because those are some of the things that needs now, a collective, priorities as well. So those are some of the things that will be able to ensure that communities are able to get better services and ensure that they are part and parcel of the decisions that are to be taken. And we need a strong paradigm shift. Now we are currently focusing on being curative rather than prevention. And we need now to balance both because are equally, important as part of, to complement each other, as it were. So those are some of the things that ought to be done. But civil society is strongly committed in the implementation of the NSP and PIP in the context of the province.
So noma sithwele idombolo lika Trump re kwile ka letlalo re le ma-Afrika Borwa, and we are turning the tide as best as we can. I want us to wrap our conversation. Dr. Kate, the importance of the commitment of civil society and the private sector and collectively working with government in reducing new HIV infections and ending AIDS as a public health threat by 2030. It's ambitious. SAIS saying there's a possibility, things are happening. But how do we move between now and 2030 as South Africa so that we can say when we gathered as a province of Gauteng on this day, on the 8th of December, this is what we said, and this is where we can get by 2030 from your point of view and science point of view?
We have the tools, we have the skills, we have the people, we have the expertise. And the way to get from here to there is to be inclusive in our planning, in our rollout, in our monitoring. And I'm just going to reiterate the exact same message. Keep the community at the center. People have to be at the center. Don't deliver services to people, deliver services in partnership with people. And rolling out our new innovations with that message clear in our minds, keeping the balance between prevention and treatment, and that is the pathway to 2030.
All right, the same question, I'm posing it to you, Dr. Mkwashu. I know in the response sector, you are the mother of NSP. And, when you guys gathered, we didn't have some of the challenges that we had, but we were still ambitious enough to want to get to 2030. How do we respond collectively to mitigate on what we're faced with?
Thank you. I will will say that one of the key things that we really need to look into, if we, as South Africa, as Gauteng, if we want to get into 2030, with a positive target, we should strengthen our prevention strategies. I'll give you an example. If you look at the current Close the Gap campaign, Gauteng currently, from the beginning of the campaign up to where we are currently, this, although might be numbers that they still have to go and clean up, they have only brought back 53% of the people who were lost, which is plus or minus 92,000. And new HIV infections, they are ranging at almost the same number, 82,000, from the beginning of the campaign up to where we are. So if you look at 82,000, you look at 91,000, they are not really far from each other. So it shows you that, yes, they are coming back. And at the same time, we are getting the same number of people who are new HIV infections. Colleagues, at this age of technology, at this age, of messaging, at this age of social media, prevention. That is the key thing that needs to be done.
All right. Same question to you, MMC, as we wrap up as well. Commitment of stakeholders, commitment of civil society and private sector. What is the way forward?
I think as SANEC has put it, we need to prevent rather being a responsive government. If we can ensure that all the communities understand that there is no stigma around HIV. And I think this generation of ours, my 2K and 1K, I think they are in a better position to show us that they are not scared to come out on Twitter to post that, I am living with this disease. And those are the kind of messaging that the elderly must start educating, that HIV is not a stigma, it's something that you can live with, it's something that you can actually grow with and be normal as ever. But we have forgotten communities that are still left behind, for us to make sure that we reach out to them, ensure that they understand the services and the impact of using the services that the Department of Health is bringing to communities. It will actually help us to actually close the gap. Check communities that are affected is our townships, because that is where we try at most best in informal settlements. As much as we trace certain number of people within the squatter camp, next time when we go there, they are no longer there on the basis that you all know that squatter camp, they are just rotation. But we need to make sure that we reach out. Our civil society is doing that. Department of Health is doing that, but we must make sure that we reach out, get a number back on treatment, so that by 2030 we can have a society that no longer sees HIV.
All right, Dr. Selepe, your final thoughts as we close up, your final message.
No, thanks, Penny. I think the colleagues have mentioned critical points, which also as a department we embrace. Part of that is as we are innovating and creating youth-friendly clinics that would then be able to assist the youth. But also what is critical with our team as well is the fact that we need to create a service that is almost directed by the community in terms of what they want, not what we think as a department that they need, but what they need, but also working hard on preventative measures as our public health systems, they work with our HAST and our district health services. Thank you.
All right, final words, Mr. Monwabisi Basa, from people living with HIV.
No, thank you very much. I think what we need to do at this stage is to ensure that the work that we've been doing as this multi-sectoral, body, we continue to do that. Number two, all we need to do is to ensure that we deal with stigma amongst the key population, because it's still there. And we need to ensure that those people are prioritized in terms of accessing services, are the ones that are now beginning to pull back, not going to the facilities as well. In terms of awareness, we've got to work together. If you find government working elsewhere, civil society working elsewhere, working in silos generally, is not going to assist us, because that gets to delegitimize other stakeholders' work, but we need to integrate that and ensure that we galvanize all our resources, aggregate all our efforts in ensuring that we serve the communities in the same, sort of stamina, if you like. Those are some of the things that we need to do, and ensure that we keep our advocacy as these stakeholders towards Treasury to move away from, imposing austerity measures on the health system, because the Department of Health has to be exempted from the austerity measures so that they can be able to have an ample budget that they can able to spend on healthcare so that it improves the quality of health of the communities that we're serving. That's what needs to be done.
Because after all, a healthy nation is a productive nation. Ladies and gentlemen, thank you so much for your time to participate in our panel discussion. And to our audience as well, thank you so much for your attention. Please give them a round of applause. We touched on the gaps, where we are currently in our efforts, where they're failing, and what we can achieve, especially our young people, which are the key populations, men who are not accessing care, and so much more. The future, what does a sustainable commitment look like in practice? We try to cover that. Is it policy? And we're speaking to that. We have to be innovative in the times that we find ourselves, and the key learnings that we have, gotten from the challenges that we've been faced with, whether it was COVID, whether it is this current situation with PEPFAR and what's happening globally. So we're going to go to homes, we'll go to schools, we'll go to communities and make sure that the message gets across. So there's a lot of action that we'll have to stick to as a multi-sectoral group. That's what we've learned and heard from today, that we continue with one concrete thing.
World AIDS Day. Under the international theme that we have, overcoming disruption, transforming the AIDS response, and our own South African theme, which is renewed efforts and sustainable commitments to end AIDS. As outlined in the 2025 UNAIDS report, this day provides us with a vital moment for us to do some reflection, but not only to do a reflection, to look back on the tremendous progress that we've made towards ending AIDS. We are reviewing the evolving global landscape regarding HIV and reaffirming our collective commitment to solidarity and action. However, to be honest, we are faced with significant challenges. Global declines in international health funding, coupled with abrupt reduction in HIV assistance, threaten to undo the decades that we've had in terms of the progress to fight against HIV and AIDS. We must reach and engage everyone, and as such, there is a reason why we are having events like this. We need to create awareness and show support for people who are affected, living with, and are infected by HIV and AIDS. In this regard, I am pleased to share that we have completed the establishment of all 9 provincial private sector forums across the country. These forums will strengthen the partnership between private sector, civil society, as well as government, not forgetting our communities. In Gauteng, our provincial private sector is chaired by myself, with the assistance of my deputy, Zanele Dlamini. This with the assistance of the GAC that has shown tremendous assistance in terms of mobilizing and arranging this organization. For 2025, our community outreach initiatives were co-funded by a number of private companies like Siriti, Exaro, Afrocentric, Africa Sky Blue, and Life Assist. There's been a number of engagement that we've had with communities in our efforts to create awareness and support. In the recent month, we've had screenings done in a number of different companies and communities where we're able to reach 25,000 people. And I think this is testament of our commitment to show support to the fight against HIV. There's a common misconception that the private sector is not involved in the fight against HIV and AIDS. And I'm saying with my team, in the Close the Gap initiative that we have, surely these people are involved, are employed, that we are missing from the system. And through various workplace wellness programs, we are able to reach these outstanding individuals and get them back to care. And I think this is really the core and the strategy around having the 3 pillars, which is government, civil society, and private sector. Looking ahead, we support renewed efforts and a sustainable HIV response that brings essential HIV programs to those who need them the most, including the successful rollout of lenacapavir, a transformative HIV prevention tool. Achieving high uptake is crucial to altering the epidemic's trajectory. Lenacapavir. And I think I'm glad to see a number of youth in this sitting today. We need to create excitement around preventative measures. Surely we have programs in place, research in place. My time. Ish, you see now. Let me wrap up quickly. We need to create excitement. The youth are yearning for excitement around prevention. And I think lenacapavir is one of the things or solutions that are going to assist us to create this excitement. We need to ensure a country-led sustainability. I think we have been belaboring the point of Trump retracting the funding. Surely we need to get to a point where that's no longer a factor. And that's why sustainability in terms of our plans becomes crucial in terms of our response to HIV and AIDS. As I wrap up, Program Director, I want to leave you with this. And I think the candles that we've lit up earlier on are a sign, are a symbol. And I think with this symbol, I want to couple it with a word in Setswana or Sepedi called moetapele, meaning a leader. Everyone in this room ke moetapele. And I think the lights or the candles that we've lit are a call for us to light the way and lead our communities to a healthier and better South Africa. Thank you very much.
Thank you, Mr. Mohlala. That was our message from the Private Sector Forum. MEC, the cultural group Ritanganetswa asked that they want to perform while you are here. So they are going to perform. A few announcements, colleagues and those who are here. There are various NGOs outside exhibiting. There's also SASA, who is here to help. There's also a special announcement from the IEC, who is here to help with voter registration. Check your details, re-register if you have changed addresses. Please make full use of all the exhibitors and the services that are outside as well. You can entertain us, and I'll hand over to our co-program director to take over the last part. Thank you so much.
Hot Flames Production.
Kwadia Koma Entertainment.
them matsogo. Let's give them a round of applause. Thank you, thank you, thank you. Re gaufi le go garela. Re ga ke tlo bitsa the MEC of Health, me Namantu Ralehoko. Ke go lemosa ke reng, it is your responsibility to take your treatment. Ke rata ba le ba reng re ya ko tleliniking ra iphitlha ga ba se ke ba re bona. Continue o iphitlha but onka treatment. Let us go and penetrate to the clinics, ko dikerekeng, everywhere, sports facilities, and educate people about the importance of taking the treatment. Stress, you drink and sleep. Let's give a round of applause to our MEC, Mayor Nomantu Ngomaralehoko.
Let me thank Ridira Natla. The Ridira Natla group, they really did so well, and I'm sure we're going to bring them back again. Melundi, they must come back again, Ridira Natla, we need them. And I'm sure, and we must build a relationship with them again, so that when we have these events, at least they come and perform. That's why stars they wanted then that I perform. Pity today I'm wearing my high heels. I can do that what they are doing with them. So that's why next time I'll be wearing my tekis. So thank you so much, program directors, MEC Mutara. You have been driving this process until today, but you will still continue working with us as you have been doing before, working with us as a Department of Health in ensuring that our services, we send them to the relevant stakeholders. You have been vocal and upfront about the issues that are related to HIV and AIDS, and you want all of us not to hide and make sure that we talk about those things even to our families. And thank you, we really appreciate that you have been doing and the support that you personally give it to myself. Let me greet another program director, a friend that is always there too, to support the Department of Health. Very productive discussions that we always have, you and me, my sister. Thank you so much. Then let me greet our Premier, as you are aware, the chairperson of Gauteng AIDS Council. We have the National Policy Conference. Thus, I've kept my bag in your chair because she started here and I came to join yourselves. So, Premier, it was difficult for him to come and join you. It's not because he's undermining you that he's not here. Our sincere apologies on his behalf. The Executive Mayor of Johannesburg, Councillor Dada, that have asked Councillor who's our MMC, Eunice Mkina, to stand in for him. The Councillor Mongameli, in this zone, we have one councillor where I come from. Sibiza la puti councillor yewotize zethu zonke as our NGO. Siyabonga puti because we have 7 wards odila ngazo in this zone as a councillor. The members of the legislature that were here, as we member More and other members that are here, the executive mayors from Tshwane, Sidibeng, Ekurhuleni and West Rand, including MMCs that are here from those regions, MMCs of health, we greet you, provincial civil society leaders, and the co-chair of Gauteng AIDS Council. We really appreciate, Sisi, the support that you have been giving us as a Department of Health, including the Premier's office. You have been working very well with us, and where we're not doing right, you are upfront to raise those issues. You don't hide them. We really appreciate that because it helps us to correct the wrong. Because we know what you want and you know what we don't want and what we have not done right. You always raise it and you are not hiding it. Thank you so much for that. Don't feel bad and think that sometimes we'll think that we are Sishaya. You need to do that so that we can do the right thing, because in areas where you go, we don't see those things. We are not there at that time and we don't see those things so that we can immediately correct them. That's a real oversight that you are doing to the department and the other departments that we are working with them. who are our sister departments that we're supposed to work with, especially agriculture. Now I'm happy that you are co-opting and bringing agriculture closer to us for poverty alleviation programs, including social development. So thank you so much for that, because we will not do that work without your assistance and without your collaboration working with us. Because you know there are people that are drinking pills in an empty stomach. But if social development, agriculture, and myself who are there, we will definitely improve. As you can see that now there are inroads that we are doing in terms of that collaboration and assisting all faith-based organizations, including the chairperson of the faith-based organization in the province, Ndadeshi Vungu, who is our bishop, Siabulela Baba, and I've seen other bishops already that are here, peers, activists, and the frontline health workers. Ladies and gentlemen, good afternoon. Today as Gauteng, we gather to mark the World AIDS Day, and we do so with purpose. We do so with unity and a renewed commitment. This year's theme reminds us that ending AIDS is not an abstract hope, but it's a responsibility that we must carry together. In February this year, we stood with the Minister of Health, Dr. Aaron Mtswaleti, at Chris Hani Baragwanath Academic Hospital to launch the 1.1 million LRT Close the Gap campaign. From the moment, from that moment, Gauteng pledged to find and re-engage and initiate around 326,000 people who know their status, and you must know their status, but are not on treatment. And this province then moved immediately. We activated weekly outreach programs. We had corner-to-corner campaigns that we launched in Midlands, and we moved to other regions. We had weekly radio interviews, campus activations, and large-scale mobilization across townships, informal settlements, and hostels. So today we can report that Gauteng has reached 96%, 72%, and 97% of the UNAIDS 95 targets. Can you clap hands for that for us? Because we need to move, by the way, on this 72 that is stubborn. Then 96% of people know their HIV status. 97% of those that are on treatment and are virally suppressed. However, the second 95 remains our biggest gap, where only 72 of those who know their status are on treatment. That gap then is the heart of this campaign. It remains our biggest challenge to end AIDS. To close this gap, we have deployed 16 mobile clinics, expanded testing and TB screening, trained hundreds of HTS counselors, and strengthened our partnership with civil society, with municipalities, with higher education institutions, and community structures. Our teams have reached thousands through social mobilization, testing nearly 40,000 people in November alone, initiating every positive case on treatment immediately. And I'm sure, Dr. Ngwashu, you will be happy that at least there is this target that we have done of 40,000 people just in November. And we need to improve in December. There is nothing that stops us if we've managed in November to reach 40,000 of people that we have tested as a province. So program directors, we must be honest. The moment is improving but fragile. Johannesburg and Ekurhuleni still carry the largest share of remaining treatment gap. Retention remains a concern. Many people start treatment, but life challenges make them stop. That is why then we are working more closely with communities, peer networks, youth groups, men's forum, and faith-based organization, which is very critical. And I'm happy that when we work with men's forum now, we're able to have men's desk in the clinics, and it's helping us, but again, we need to go to the taxi ranks in every area where we find men. We're busy in the hostels now, but we have still have a gap in that specific area, because about Tatabase hostel, abafunukuza mabebizwa city. So that's why we need now to rope in donors to work with us in this program, because it's going to be much more easier when they talk to them, then we can come in with the treatment and convincing them in terms of screening. So we cannot close this gap through clinical system alone. Hence I was saying we need to bring back everybody to assist. Ladies and gentlemen, we also gather to reaffirm our understanding of the last 95. The viral suppression means health long life and dignity. And it carries a message that many still do not know. That is called UW is equal to U. Undetectably equals to untransmittable diseases. So when a person takes treatment constantly and becomes undetectable, they cannot pass HIV to another person. This is one of the greatest scientific breakthroughs in the fight against HIV. As we recommit ourselves today, we must remember that the communities that carry the highest risk, like young people, men, children, and key population groups. And I'm happy again that we didn't close the clinics of key population groups, even if they were closed because of that person that decided to sabotage us. We made it a point that we opened those clinics. 2 weeks back, we've opened another clinic just in the inner city of Johannesburg. And I'm proud that the key population groups, about 3,000 of them, that were with me on the day that we're opening that clinic. So we're going to make sure that even in other areas where those clinics are not enough, because they are in the metros, we need to have more. We can't have one clinic. We will even have health posts so that during the day, they are able to grab their medication, so that it's easier and it's closer to the areas where they are. Hence, now we've asked the team that is led by Ndate to start identifying now the areas where we find our key population groups. Besides that, we know where we can find them in the inner city of Johannesburg. Areas like Nigel, areas like Springs, that's where we must go and get them again, because they are far from us and the clinics are far from them, because we only have one clinic that is just here in Forest Lawrence. So we need the areas that are far from them now to identify those specific areas where we will have those health posts and be able to reach them during the day without wasting their time, because they have some work that they must do, because when they are there, they are at work. They don't need us to disturb them, but we must provide what we're supposed to do and leave them. So the call then is that we need a renewed efforts, which is not only about biomedical interventions, it is also about fighting the stigma, supporting those who live with HIV, and make every clinic, every campus, and every community space welcoming and youth-friendly. And we want to thank again the Department of Higher Education for allowing us to partner with them in their clinics that they have already in their institutions. It has really made our work easier, because we know where we can go, and the students are appreciating of that, because we're even giving them the counseling, the mental health programs, we're doing directly with them in those institutions. So again, we're saying we are recommitting ourselves today then of making sure that we remember those communities that carry the high risk, and we remain determined to meet the national targets and contribute meaningful to the global goal of ending AIDS. We will strengthen staffing, we will improve data quality, we will deepen partnership, and ensure that all districts maintain the weekly momentum needed to close the IRT gap. We are not done, but we are moving. We are moving now with agency, not slowly as we've been doing, because time is against us. I want to thank you then, SANEC, the Gauteng AIDS Council, civil society, faith-based organizations, NGOs, private sector partners, and the people of Gauteng. Your commitment is the backbone of our progress as a Department of Health. Today we renew our efforts. Today we strengthen our commitment. Today we can and we will end AIDS. Thank you, program directors. Ndiyabonga, kiyaleboga. Enkosi. Thank you.
Ke kopa re mo fa matsogo. O ka ra utlwa ga le majita di ka di flight mo. Ka kutlwa di flight mo, di flight di kae? Le kholokwane e kae? All right, thank you. Thank you, Honorable MC. O ka re a garela yaanong. E ke tla go kopa Councillor Mongameli Mnyameni from Region F, COJ. Ara tumele fo re ska re tle ka mo ntlong ya motho ra motswa fela ra itsamaela. Re go lebogile.
Hello. I don't know what is this, afternoon or good day. Good afternoon. I've been here for a long time. Can you hear me? Thank you very much. My job is so little to speak after my leadership has spoken. I thought it will be the privilege for me to thank everybody that is being here today, starting from the Premier of Gauteng in his absence, represented by Imama, our MEC that we love her dearly, MEC, we love you dearly that we are here today and make sure that you're sending a very progressive message to the people of Gauteng. And also let me thank very much in the absence and welcome, and also then the executive mayor of the city of Johannesburg, the shotgun, Silo Enoch Dadamurero in his absence, that was represented by Eunice May. AIDS. In those few words, let me also welcome and thanks all the executive mayors that are here today, the MECs that are here today, and including the program director. Then let me thank you all for the good work that you did today. Let me thank the MMC that were here today, and thanks all the stakeholders, all the doctors that are here, the Gauteng. When I was sitting there, I felt that maybe I'm in a wrong place. I saw these civil activities saying, this fire brigade, beside fire brigade, kuyacha. Then I looked around and said, hey, where I am. They reminded me that I thought maybe I'm in a conference of my organization, and of which I'm here now. We are here now to affirm that we are going to put a stop to the HIV. Let me welcome everybody and thank everyone that is being here. Good people, let 2030, when it comes, enkosi.
O ka re fihle ko bofelong. You've been such a wonderful, wonderful audience. Thank you so much. We really appreciate your time and efforts. We're gonna ask all the VIPs will go to the holding room that are assigned, all the VIPs, and then, as you are not important, you are not VIPs, you are also VIPs, but you'll be ushered to go that side of the back for catering, then all the entertainments, the choir and entertainers, this is now your time to shine. Thank you so much. All right, sorry. Khona le phone e tholahetseng ko toilet, mama o lahlile phone ko toilet. Anyone who is swearing, please come forward. O swearing phone e seng ya gago, come forward. Come forward, phone. Oh, thank you. I love you too. Thank you.